Why is contrast dye used in cancer court scans? Imagine trying to find a tiny fish in a big pond. Without help, it's hard to see the fish clearly. That's what a regular court scan can be like when looking for cancer. Contrast dye acts like a spotlight, making the important parts stand out. When doctors perform a computed tomography scan, they take detailed cross-sectional pictures of your body. These images help them see the size, shape, and location of any tumors or abnormal tissues. But sometimes, tumors blend in with normal tissues, making them hard to spot. That's where contrast dye comes in. It is usually injected into a vein, often containing iodine, which is a special substance that interacts with X-ray beams. When the dye is in your bloodstream, it travels to different tissues and organs. Cancerous tissues and blood vessels absorb the dye differently than healthy tissues do. This causes the cancer areas to appear brighter or more defined on the scan. This difference helps radiologists see the tumors more clearly. It's especially useful for understanding how big the tumor is and whether it has spread to nearby tissues or organs. Contrast dye also highlights blood vessels that feed the tumor, which can be very important for planning treatments like surgery or radiation therapy. Sometimes, patients might also drink a special contrast solution before the scan if the focus is on the stomach or intestines. This helps outline the digestive tract so doctors can see it better. The main reason for using contrast dye is to improve the quality of the images. Without it, some tumors might look just like the surrounding tissues, making diagnosis more difficult. The dye helps differentiate normal from abnormal tissues, giving doctors a clearer picture. It also helps identify abnormal blood vessels that are often linked to tumor growth. For people living with cancer, these clearer images mean better information about the tumor's size and spread. This helps doctors make more accurate decisions about treatment options. Most people tolerate contrast dye well, but it can affect kidney function in some cases, especially if the kidneys aren't working well already. That's why doctors check kidney health before giving the dye. After the scan, the dye is usually flushed out of the body within a day, especially if you stay well hydrated. So, in simple terms, contrast dye makes cancer easier to see on court scans. It highlights the tumors and blood vessels, giving doctors a better look at what they are dealing with. This helps in diagnosing, staging, and planning the best treatment for each patient.